We rely so much on our feet, don't we? They help us to stand and help keep us balanced. And every day they cover a lot of kilometers just to get us from one place to another. It's no wonder they get tired. And maybe that's why a foot rub feels so good. But there may be another reason, one that gives the feet another important responsibility. As a stimulus for the body's own power to heal itself. The foot is the foundation for a therapy called reflexology. Ancient practitioners divided the body into 10 vertical zones, which run from the tips of the toes to the top of the head and ends of the fingers. They believe that all parts of the body within any one zone are linked, and that applying pressure to one part of the body helped relieve pain or discomfort in other parts within the same zone.
By working on the zones of the feet that correlate with the zones of the body, we stimulate energy through energy channels and neural responses.
Reflexologists believe that an autonomic reflex system works with the nervous system and that stimulating that reflex system can clear blockages and return the body, mind, and emotions to a healthy state. By applying pressure to a particular reflex point in the foot or in the hand, the reflexologist can stimulate the energy in another part of the body within that zone. Reflexology is usually practiced by trained non-medical professionals who work in clinics or in private practice. Your first appointment will likely involve an initial consultation where your reflexologist will want to know the details of your medical history as well as your lifestyle background.
In the first consultation, I want to find out a bit of their medical history, if they've had any accidents, if they've had any operations. I don't want to be manipulating something that I shouldn't. I need to be careful. If they're on medication, I have to also restrict the pressure and also restrict the time.
By doing that, we promote circulation, elimination, and relaxation.
Treatment usually begins with relaxation techniques to soothe the body and loosen the joints. Then the therapist will work the whole foot before focusing on specific problem areas. While pressure on the hand or foot is not intended to be painful, if you do experience pain in any area, the reflexologist will see it as a sign of blocked energy and work on that area to free the blockage.
In the zone, if there's a blockage, we take a look at is if it was a dam and we had blockage in the dam. That's going to flow or stop the flow of proper circulation. And basically with reflexology, we're working on circulation, elimination, and relaxation. And to keep an organ healthy, that it needs those things. So if there are types of blockages in there, it can feeder up through the zone and cause problems in other areas.
Treatment usually takes from 30 to 60 minutes, depending on your symptoms. Some people come away with a feeling of total relaxation. Others feel revitalized. It depends on the individual. Reflexology is great for kids too. Keep the session short, but even babies will benefit from a little gentle stroking of their feet. After all, who wouldn't? If you're in the early stages of your pregnancy, you should let your reflexologist know so she can modify your treatment to better suit your needs. However, if you are pregnant, it's not recommended that you try to do the treatment yourself.